Assalamualaikum. We are from Group 3, and for this presentation, we will delve into the importance of healthy life based on the theory, the nature of human being according to the theory, counselors' roles to promote a healthy lifestyle, and lastly, the conclusion. Now, without further ado, let's begin. Assalamualaikum everyone, my name is Nur Anis Nabila. Now moving on to the next subtopic, which is the importance of a healthy life based on cognitive behavioral therapy or CBT. Let's start by understanding the foundation of cognitive behavioral therapy, which emphasizes the interconnectedness of thoughts, feelings, and behaviors. CBT highlights the significance of nurturing good living habits to enhance mental health and overall quality of life. In mental health, CBT is rooted in the intricate relationship between our thoughts, emotions, and also actions. This approach underscores how nurturing healthy habits can profoundly impact our mental well-being. Exercise, a balanced diet, and also sufficient sleep form the cornerstone of a healthy lifestyle promoted by CBT. Research shows that regular physical activity stimulates the production of endorphins, hormones known to alleviate anxiety and depressive symptoms. Moreover, practicing mindfulness and relaxation techniques enhances emotional control and stress management skills. By learning to navigate unpleasant emotions, individuals bolster their emotional resilience, promoting psychological well-being. Healthy behaviors foster higher levels of self-efficacy, the belief in one's ability to accomplish tasks and goals. Setting and achieving wellness and objectives build confidence and empower individuals to overcome challenges, ultimately enhancing their long-term mental well-being. Furthermore, adopting a healthy lifestyle helps mitigate cognitive distortions, erroneous thought patterns that contribute to psychological distress. By questioning and altering these negative beliefs, individuals develop a more optimistic and adaptive mindset. Perhaps most importantly, adopting a healthy lifestyle serves as a protective barrier against the development of mental health issues. Regular physical activity, a balanced diet, and adequate sleep are associated with a lower incidence of depression, anxiety, and other psychiatric disorders. CBT recognizes the symbiotic relationship between mental and physical health. By prioritizing physical well-being through exercise and nutrition, individuals optimize brain function, leading to improved mood and cognitive function. In conclusion, cognitive behavioral therapy underscores the profound influence of healthy lifestyle choices on mental health and overall well-being. By acknowledging the interconnectedness of thoughts, feelings, and behaviors, individuals can cultivate resilience, enhance emotional control, and pave the way for lasting improvements in their mental health and quality of life. Now that is all from me. Moving on to the next presenter.
I'll be talking about the nature of human being according to CBT. To start off, the nature of human being according to CBT is broken into several factors. As mentioned before, CBT is linked or intertwined between our thoughts, emotions, and behavior. Therefore, this theory views of human nature indicates that humans have the ability to change and grow. They can highlight the negative thoughts that they develop and challenge themselves to avoid it, build new characters, amend their social skills or relationship with others, and lastly, improve their personal values through therapy with CBT therapists. One of the human nature of CBT is that implementing a specific behavior towards an action can develop a mark or mindset that contributes to negative health conditions. In other words, learned behavior that is developed due to several reasons or different reasons that triggers an action, a specific action, can contribute to developing a mental health condition. For example, a specific event triggers the patient to behave in an unusual way. They might direct themselves to ignore it, which makes them dodge away from trying to challenge themselves facing the problem, which results to a challenge for them to grow later facing that problem. This then leads to maladaptive behavior, which is caused by faulty learning or reinforcement pattern. So in this case, therapists should help the patient face their challenge or fears in order for them to grow. Only that, interpersonal relationship is also an influence to the thoughts, behavior, and emotions. CBT views of human nature recognize that social skills such as between friends, family, co-workers can have a great influence on the way we think about ourselves. To elaborate, if we surround ourselves with toxic people who influence us to think badly of ourselves, of course that's a result to us progressing negative thoughts about ourselves, and that can lead to having anxiety, depressions, and all sort of mental health conditions. But through therapy, therapists can guide the patients to be able to push back that non-essential beliefs about ourselves and gain back the social skills that we have lost. Consequently, through CBT, they can learn to be aware and overcome their negative thoughts, develop new behaviors, and improve their relationship with others through communication and interactions. This theory views human nature as influenced by the interaction between the three main factors mentioned before. It highlights on the learned behavior developed by human experience and reinforcement. Human nature, according to CBT, has the tendency to change, and they have claimed that individuals can think rationally and irrationally.
My name is Nurul Ismahani binti Haraimi and I'm from B. TESL. Do you know one of the counselor's roles in promoting a healthy lifestyle in a school setting is mental health counseling? Mental health is a state of a mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and also contribute to their community. For a brief explanation, CBT is great for school counselors to help students live a healthier life. It teaches how thoughts affect feelings and also actions. By changing negative thoughts, it helps students cope better, reducing anxiety and also improving well-being. Through practice, it rewires the brain for healthier thinking, making it easier to handle challenges and also promoting mental wellness at school. Do you know how crucial school counselors are in promoting a healthy lifestyle in school settings? They go beyond traditional mental health services, advocating for all students' mental and also physical well-being. They raise awareness about mental health, offer short-term counseling, and also connect students with long-term support in the community. There are few specific programs to promote a healthy lifestyle in school setting. Firstly, it is called as an early intervention service. Early intervention services in a school help students who need extra support with their mental health. They offer skill groups for managing emotions like grief, anger, anxiety, and also sadness. These services are proactive, meaning that they step in early to help students deal with challenges before they get worse, stopping potential mental health problems from becoming more serious. The other program that can be applied in a school setting is called Health Promoting Schools, also known as HPS. HPS focuses on making schools a healthy place for students in every way. They encourage healthy eating, exercise, and also preventing obesity. HPS also teaches students about health so they can make good choices. They work to stop leading causes of sickness and death by creating a healthy environment and helping students to develop important skills. This helps not only for students but also involve the whole school community and beyond.
Assalamualaikum warahmatullahi wabarakatuh. My name is Amin Abihan bin Muhammad Nazri, and now I'm going to explain about substance abuse counselling. So, substance abuse, which is also known as drug abuse, is the use of a drug in amount or by methods that are harmful to the individual or others. It also refers to a pattern of using a substance that cause significant problem or distress. Substance use disorder, or we call it in a short form SUD, includes abusing legal substances like alcohol, nicotines, prescription drugs, and marijuana, as well as using illicit substances like heroin, cocaine, and marijuana. So, substance abuse counselling can be used to handle this kind of problem. Substance abuse counselling is a specialized form of therapy designed to help individuals overcome SUD. It involves a range of techniques and approach aimed at understanding the cause of addiction, recognizing risk factor of relapse, and developing coping strategy for stressful situation. So CBT, or other name cognitive behavioral therapy, is one of the key aspects of substance abuse counselling, which is a common technique used in substance abuse counselling. It focuses on changing negative thought pattern and behavior that lead to substance use. CBT helps individuals identify triggers develop coping strategy, and work towards healthier behavior. In school, there are a lot of programs that promote a healthy lifestyle and address a substance abuse prevention. One of them we call it life skill training program. So life skill training program is a school-based substance abuse prevention program that designed to teach students essential skill for resisting peer pressure to use drugs, alcohol, and tobacco. The program focus on building social and emotional competence, decision-making skill, and resilience skills through interactive lesson and activities. The program, life skill training is also typically implemented as a school-based curriculum delivered by trained teachers or counselor. The program is effective in reducing substance use initiation, improving resilience skill, and promoting healthy decision making among students. So another specific program in school that can promote a healthy lifestyle and address substance abuse prevention is called it is Too Good for Drugs program. Uh, the Good for Drugs program is a school-based prevention program designed to prevent substance use, violence, and other risky behavior among school students. The program uses interactive lesson, activities, and games to teach students social emotional skill, decision making skill, and resilience skill to avoid drug and other harmful substance. Too Good for Drugs program is typically implemented as a multi-session curriculum delivered by trained teachers or counselor in elementary or middle school. The program is effective in reducing substance use initiation, improving reversal skills, and enhancing social emotional competence among students. Thank you.
Hi everyone, my name is Amir Shahid bin Helmi, and now I will talk about the conclusion. In summary, cognitive behavioral therapy, or we call it as CBT, holds that human nature is indirectly linked to thoughts, emotions, behaviors, and interpersonal relationships. Human nature is dynamic and development capable. According to CBT, it draws attention to the ways in which a person learns behavior, erroneous thought patterns, and social interaction can all affect their mental health. People can improve their interpersonal relationships, recognize and overcome negative thoughts, and adopt healthier habits by using cognitive behavioral therapy or CBT. Counselors play a crucial role in promoting healthy living, particularly in educational environments. They can implement a range of CBT-based programs and interventions to address mental health concerns and end substance abuse. Early intervention services and health promoting schools are two significant programs that can be put into place in school to support the students' mental and physical well-being, or HPS. The primary goals of early intervention services are to support students in managing their emotions, proactively address their mental health needs, and help them overcome challenges before they worsen. On the other hand, HPS promote a holistic environment that supports overall wellness through the promotion of healthy behaviors, physical activity, and informed decision making. One benefit of these programs is early intervention, which has two advantages. The first one is it increases endurance and keep mental health. The first one is it increases endurance and keeps mental health problems from getting worse. Subsequently, wholesome approaches such as endorsing health schools create an environment that fosters mental, social, and physical health. It also supporting a holistic approach to health. And the second one is skill development. Too Good for Drugs and Life Skill Training are two examples of courses that provide students with the skills they need to resist peer pressure and make informed decisions. However, there are challenges as well. First of all, the implementation of comprehensive programs require resource constraints such as sufficient human, financial, and scheduling resource. Next one is the stigma itself. The stigma attached to substance abuse and mental illness can still restrict program effectiveness and participation even in the face of efforts to increase public awareness of mental health issues. Finally, the long-term effects. Sustaining long-term behavioral change and sustained benefits in a school setting can be challenging to achieve through ongoing support and follow-up. In conclusion, there are many benefits to promoting a healthy lifestyle and utilizing CBT-based programs to address drug abuse and mental health issues in school. Even with certain challenges, through promoting a healthier, more positive school climate, these initiatives benefit both the community and large and the individual students. That's all from me. Thank you.